This is Donna Craig, student assessment number 2. And I am in a sparkling clean patient room on the Caring Hand Senior Services Geriatric Behavior Unit at Jasper Memorial Hospital. Thank you to the hospital for allowing me in here. And we'll get started.
Scan the room.
I'll scan the room in the middle. And the first thing I do is inspect the thorax, and I note typically pigmented Caucasian skin, a little bit of redness from the sun, tan lines on the arms, some bug bites or something, some sort of macula on his left arm, and I don't see any pulsations or any odd movements other than his breathing. No movements other than his breathing. It's not an odd one. And I'm going to palpate this side. Let me know if anything hurts. And I don't feel any masses or tumors. Now you can turn around. We're working within the limitations of no camera person. And on the back, I inspect, and I see a continuation of male pattern hair distribution and a little bit of pattern from the blanket. I don't see any adventitious movements. And I'm going to palpate again. Let me know if anything hurts. I see a bit of a macula up here. But I'm not finding any masses or tumors or anything out of place. So I will palpate. Or percuss, might use the right word, why don't I? Okay, and I'm going to check for tactile fremitus. Every time I touch you, please say the word 99.
99. 99. 99, 99.
And there's appropriate vibration bilaterally, and check for thoracic expansion. Please take deep breaths. And my hands and thumbs do move outward. And now we can percuss the diaphragmatic excursion. Please lean forward and hug yourself. Oh, take a deep breath and hold it in. Might help if I do that. Get the diaphragm down. Yeah, I'll get that right about there at this point. Okay, now breathe. Then take a breath and exhale as far as you can. Exhale and hold it out. And I think that's right about there. And breathe. And then, since he has 2 lungs, take a deep breath in and hold it in. Take a breath and exhale as far as you can. And hold it out. And that's right about there. And you can breathe. And on the right, we have 4.5 centimeters, and on the left, we have about 3 3/4 centimeters. You can breathe and relax. And then we get to auscultate. There we go. Take some deep breaths. Now, put your hands on your head. Continue to breathe. Thank you. And you can relax. And now we're gonna scan the room because I have to move the camera. And you will note that typical of a behavior unit, this is everything is locked up. So there is nothing around, and I have no notes or anything else. Just my stethoscope, or the borrowed stethoscope, and a ruler and a pen. Make sure that we can see what we're doing. And I will auscultate his anterior. Are you in there? Yes, you are. Lung fields. Deep breaths, please. Okay. Okay, thank you. And he has clear lung sounds bilaterally. Now we're going to quick check some pulses, just because it's easier for me while he's sitting up. First we're going to do the temporal. And then keep your arm relaxed. And look at the brachial. Right there. And radial. And keep your arm relaxed. A brachial. And a radial. And now you can lay down, please, sir. And now check the popliteal. Let me see. Yeah. Check the popliteal between the heads of the gastrocnemius. Okay. And posttibialis. Postibial. I don't know why I tried words bigger than they really are. And the other post-tibial. And then dorsal pedis. And a dorsal pedis. And they are all even and of appropriate strength and weight. So now we move on to the rest of cardiac, and I will observe that there are no lifts or thrusts or any other odd movement. And I just do notice a macule right there. And I'm going to check the PMI. And no murmur on the mitral valve is felt. And palpate the tricuspid and the pneumonic, pulmonic, and the aortic. And then we auscultate all of the same. And we go down to second intercostal space, right sternal border. And the aortic valve. And left sternal border. Start over. 1, 2. Second intercostal space. And check the pulmonic valve. And then we move on to Erb's point. Oops, sorry. And then we go down to the tricuspid. And then we go to the mitral. And no murmurs or any other adventitious sound is noted. Now we inspect the abdomen, and I note a few little cherry angiomas, but other than that, nothing significant. And we'll auscultate. First for friction rub. And no friction rub is noted. And then for bowel sounds. Might help if I have this going in the right direction. We'll do that again. Thought it was awfully quiet. No friction rubs were noted with the stethoscope the right way. Okay, that sounds much better. And valve sounds are active in all 4 quarters. And now we will auscultate the renal arteries. The iliacs. And then the femorals. Hip, hip. Iliac crest and femoral artery. And those are all even and appropriate. Ooh. And hot flashes are fun. And then we percuss. Oh, and I do have to note the shape of his belly related to his BMI. And then I'm going to percuss for the liver. That is the right spot. Right there. And now I'm going to go right there. And that gives us about 5.5 centimeters of liver. And then we'll continue across. And note that the spleen is here. And palpate. We'll palpate in general. And no masses, no tumors are noted. And then palpate the liver. Right there, and then on up under the rib cage. And then his spleen is nicely tucked up under his rib cage right here. And then I palpate his kidneys. Left and the right. And that's it. We're done. And thank you. And if you want to see the further enjoyment of our unit, that's storage cubes where patients keep their belongings, and all our gloves and other supplies are kept locked away.